Hey everybody, Dr. Fedich here, Village Family Clinic. With a couple of questions I asked this morning in the clinic, so I thought I'd shoot this quick video for everybody, explain these things a little bit better here. So, title of this video is going to be how long. So I got asked two questions about how long, and we're going to explain them all right here. So how long? So I got two questions, kind of same idea, and how long, how much. So we're going to talk about that. So I got asked by a patient didn't know a lot about chiropractic. How long was chiropractic school? So I'll tell you a little bit about that. So to become a chiropractor, you first need a bachelor's degree. So typically you'll get a bachelor's of science degree. That's when we're undergrad classes like anatomy, physiology, organic chemistry, those types of classes. So that'll be a 4-year degree. For myself, I actually did an accelerated science program, so I did my full bachelor's degree in only 3 years. So I took extra classes and finished a little quicker. But you're going to go get your bachelor's of science typically in 4 years. And then our secondary degree is a DC, which is Doctor of Chiropractic. And that is another 4 years as well. So typical chiropractic education is going to be about total 8 years, 4 years undergrad, 4 years of graduate school. In chiropractic school, you're going to do a lot more in-depth anatomy. 3 hours we did a day in anatomy lab, a couple hours a day in neuroscience lab, dissecting brains and human bodies, working on cats as well, but a lot of time, 3, 4 hours a day with human cadavers, neuroscience, all those types of classes. And then after a couple years, you get into the chiropractic end, working on patients. We have to learn how to take and read x-rays, MRIs, all that kind of stuff. The last about year of that's going to be in a clinic, so we're going to work in a different clinic. So I did my undergrad at Hartford, University of Hartford, Connecticut, grad school at New York College of Health Sciences. And your last year of that, you go into an outpatient clinic type area, and I was in Levittown, Long Island for that. Once you do those 8 years, you have to pass a series of 4 board exams. So we're board certified as well. There's 4-part board exams. They're typically a day or two long, 6 to 8 hours of testing, and you have to take 4 board exams to pass. And then whatever state you move into or practice into, you're going to have to get a license in that state. And almost every state has another further exam you have to take for that state as well. So currently I'm licensed in New Jersey, Pennsylvania, and Florida. I have 3 active licenses as of today. So that's how long chiropractic school is. Those asking about it, just had an intern in here the other day asking me about this as well. Then how long do we come in for? How often, I should say, to come in for? Just had this conversation 10 minutes ago. So I like to draw this, and you probably heard me talk about this again. Right here is optimal health line. We're healthy when we're young. However, not everyone's even born healthy. So we just read a recent study that 8 out of 10 children during birth, their neck is yanked or pulled as they're coming out and they get neck trauma. So not everyone's even born perfectly healthy. So about 80% of sort of neck injuries. So that's why it's important to get your kids checked as well. And down here's where pain happens. So typically, we're 18, we feel pretty good. Bumps, bruises, sports, and eventually we get some aches and pains, right? We do our chiropractic adjustments. We're usually able to get the people out of pain, but it's really important to keep them that way, right? So we kind of redraw this, and then people, once they're feeling better, like I said, just had this conversation, they're feeling good, they're coming in for maintenance care. So we got them out of pain, they're somewhere up in here, they're on maintenance care. So there's people ask me how often or how long they come in for. So kind of draw this picture for them. We start back up here. So I'll say, if you come in, if you come in every week, let's say, we'll probably do this, right? So as we get older, we're all getting a little bit worse. So it'll drift that line, be nice and slow. Every 2 weeks, probably be a little bit more like that, right? If we do every month, it'll be a little bit more like that. So that's one of the easiest ways to get people to draw. No matter what we do, we're all getting a little bit older every year, but we want to minimize that and minimize as much as we can. If we're doing once a week, that's going to be a pretty slow line. Every 2 weeks can be a little quicker, but still that usually keeps things pretty good. If you're feeling well, every 2 weeks will keep you that way. Once a month, we're going to slow that down for sure, but we're definitely a little more likely to end up in the pain zone at some point. So just to answer questions, how long schooling is and how long you come in for, how often you come in for. Just 2 questions I got this morning. Thought it'd be interesting to a lot of our patients out there. Hope everyone has a great weekend. We'll talk to you soon.